Okay, so we have a case, cellulitis, and the person is do a lot of fitness, follow the diet, but there's still the problem in this area. If you see this, if I squeeze the skin, you can see the cellulitis coming up. Also, you can see the spider vein. It could be I would say stress-related stuff. It's not nutrition, so we skip the nutrition. 100% it's not nutrition. It could be also poor circulations, and of course people say if the stress, emotional stuff happening in the body, that's create that kind of pops up in your skin. You know, people get some acne, stuff on the face, rashes in the face, hair falling off, all that stuff. It's also hormonal. We don't know that. We're probably going to tell the client to test the hormones. But like I said, as you can see the squeeze, and it's create that, visualize the cellulite, that skin like a bubbly, like sponge. Okay, now what we're going to do, we're going to ask the client, squeeze the glute, squeeze the glute, squeeze. You see, this one is like really not pumping up, so it's probably muscle is weak up here, and also the circulation is poor. Also, what I'm going to do, I'm going to do today sugaring or honey massage, which is create a lot of moisturize the area, open the pore, get some breathing for your skin. Good stuff. And also it's a not the lymphatic, I would say this is more fascial release, because we move the fascia, upper layer of the body. It's between the skin and the muscle. Also, highly recommend to do lymphatic massage, just get this lymph go through. So, and we're gonna do this maybe 10 sessions and see the benefits of all this massage. Like I said, if you do not follow the diet, if you do any sports and you go to this massage therapy or whatever we do today, it's might not gonna work, and you just waste your money, okay? But that's all right. So I just licked that honey, very delicious. So this is organic honey. We don't use any chemical honey. The best way is to buy honey from the bee farmers, so they don't do any crazy stuff. So here we go. This one is really expensive one. I bought this in Sprouts, really good stuff. So like 15 bucks for this can. Can you believe that? All right, here we go. So basically you just apply the honey to this area. We stay away from the area between legs. We don't put our hands up there, especially if I'm a male and my client's a female. And I'm just apply a little bit honey, and all I do just a clapping and kind of lift that skin up. You see, this is what I'm doing. This is my motion. Just lift it up. It stick to my hands and I lift it up. In the beginning it's fine, but after it's become a little bit painful, so you always talk to your client. And I know most clients, women, they can take the pain tolerance, so just ask, communicate. It's a lot of sticky stuff. I will probably prepare two buckets with the cold water and hot, and also do stimulate the skin, the body. You know, this contrast shower when you muscle contract and relax, contract and relax. That's all about to bring the blood to the area, and the blood is gonna heal that. But also, this is the message to the brain, aware of we need attention to this area. And of course, gluteus exercise. So you can see how she's starting making sound. That's mean it's sticky.
It feels like I'm getting waxed.
Yeah, she's like getting waxed. But look at this skin now. Look, it's a redness everywhere. The blood has come through. Yeah, we got silly one.
Oh,
she's already hurting. You see, she can't take that. Yeah, okay, give her a little break. But you see this redness comes up, all that beautiful stuff, and a lot of stuff on my hands right now. It's a good stuff. Let's give her a little bit break. Yeah, and come back. So now I'm kind of rolling and pull back. Okay, I'm gonna be a little bit gentle here. Working most on this most cellulite area. So I kinda get that honey in and pull out. Let that skin breathe. The sauna is always good. You know, that sauna, when you sweat, you open your pore. I know it's bad for those humid states like Florida or California. You're gonna sweat a lot. Well, you wanna look good? That's your sacrifice. Here we go, a little bit more up here. I try to be gentle. You getting better now? No, she's still struggling up there. So it's not comfortable, she said. And I'm gonna stay here for about, I don't cover the area. I'm probably leave her for 5-6 minutes. I'm gonna wash it out and do it again, but I'm just gonna show you once in the video. I gotta wipe it out and do it again, but for the video purpose we just do once. All right, and I'll show you the continue. Let's let me wash everything. So let's let her hang out. So we want a good effect on this, but I will do it, stop the camera and do second time. Can do a little bit more now. Oh yeah, you see all this area. She's like, yeah.
Not know it was gonna hurt.
I love torturing people this way. You know, they coming and it's a joke, but you can see it. Yeah, all this white stuff. It's like that sugar stuff. There we go, like right here. Yeah, here we go. Now it's really truly start pops up. You can see that skin will like break down a little bit more. She don't like that area, you see. Whereas exactly that spongy stuff, and look already, we already don't see that much spongy. It's still there, but less. Okay, let me wash that. There we go. So just get that cold water and I'm start wipe it out. Wipe it out the area with the towel. Make sure it's not sticking anywhere. And you can see this. Let me get the phone closer. Camera. Everyone used the phone. It's wet around. That's okay. You now see this redness. Look at that, it's all blood. Let me get that camera. So you see all this redness, like little stuff, and here we go. Let me squeeze more. And you can see it. Let me get that focus for you. There we go, so skin. Still get, but look, this skin is much better. We need to work and improve here. Here it's almost, yeah, I still see it bubbling, but like I said, it's 10 sessions. This is, you can see the result. I mean, some people see after 5th one, but there we go. What we're doing now, we're gonna apply the cupping. And this time, we're not gonna do movable cupping, so we don't need to do I put it right in here.
Are you gonna make them super tight?
All right, just roll this way. Okay, and after we wipe out, we're gonna do cupping. This is the first time for our clients. We're not going to do movable cupping, so you can use the plastic one or silicone. If you do movable in the first time, it's like I said, it depends on person. I'm already see we don't need to do that. I'm just gonna put the cups all around this area and bring the blood to the area. So yeah, just right on the button. Pressure medium. I don't want to, like I said, traumatize my client. I want to feel them slowly to get used to the session, because if you do first one, not a good experience. Sometimes people just never come back. This is like okay, and I'm gonna there we go. Yeah, it's probably 8, 9, 10 cups. You can put more a little bit on the side. You can see this. Here we go. So I just leave like that for, let's say, 5-6 minutes. Depends on person. Also, I can do the motion. You see, she's like, oh, let's activate all this muscle. What I'm doing here, I send a signal to the brain, hey, this is right in here, this is the area, this activate this muscle, please, for me. Because sometimes when his muscle is not active, something going on, like motor control problem, sometimes just create that problem. There we go, just pop that. You can do a little bit more. I can ask you to push this foot down, push the foot down towards the table. So she activate different group of muscle. This is agonist, antagonist. You can see this. Yes, the skin pops up. Let me get the camera. You can see the like a foggy stuff inside. Also good sign. Yeah, you see that's like sponges up there. That's a good sign. There we go. So now we're gonna leave our client for 5-6 minutes and start doing the third procedure. Okay, so we come back to our client. Like I say, I'm not put too much. You can see this. She's always moving around and really good redness around the skin. Let's put this cup first. And I'm gonna wipe it out more. Like I said, I'm not trying to do crazy stuff in the first session because people really get scared or it's painful and they not very like it. So the treatment have to be a little bit pleasant in the beginning, and after you can add more and more. So let's see, it's not bad. I don't see any like, you know, purple stuff. Let me squeeze. You see the more where the cups is, like here. Let me get this way. Yeah, you can see it's less bubbly, but as I said, nutrition, fitness, and emotion, the mental stuff, everything go to your skin first. If you get stressed about something, that's come. So next treatment for me, I'll do muscle activation. This is called that we do muscle spindle activation. I'm activate all this area, glutes, because we sit a lot and we're struggling with the blood circulation and weakness in this area in the butt. A lot of people get weakness in the butt. It said the butt is tight, and you come to massage therapy, they start stretching this or dig in there. I don't know what they dig in there, but you need this muscle is being active. That's why the people start stretching. It's not the solution. Stop stretching your muscle. We want a strengthening, balancing with the strengthening. Okay, really good. Next one, I use specific cream and lotion. I don't use any oil. You don't want to put any garbage. I use CBD with a mint and arnica in there. Looks really nice. Smells good too. Then you can buy at our office. It's only at our office, so we don't sell online, and you can find us online too. Only inside the store. Really nice smell. After I tell the customers, do not take a shower right after the session. So the sessions have to be most likely in the morning, so that all the stuff is going inside your skin. And yeah. So We're gonna do only one side, so we're gonna see the difference between left and right.
What?
I'm just joking. She's like, what? Can you believe she's one leg is gonna be nice and the other still gonna be cellulite? That's gonna be sad. Okay. And this is the rolling. Let's make a sound. I used to wasn't do that. I can put the oil or W40. Just joking, no chemical. This is light. I usually go up to steam. I'm gonna go fast. I think at this towel jam sometimes coming out. There we go. Just for the purpose camera, I open a little bit less the space. That's why it is always coming back. Yeah. Don't worry. If clients try to help me, I always say I charge more for the help, so they stop helping me. And I do this for 10, not to 10, maybe like 8 minutes, and look at this redness already. And we'll see what's going to happen after 10 sessions. Thanks for watching.